Okay, we're doing part 14 from the book here, Prevent and Reverse Stroke and Heart Attack by me, Pete Rogers. We're on figure 417. Let me give you the page number of that. If you're going by page numbers, page 103. So what we basically have here is a normal neuron. Here's the cell bodies where the nucleus is. Here's the incoming information through the dendrites. Dendrite means like tree branches, so incoming information. If the neuron is activated, it'll release an action potential beginning at the axon hillock that will travel down the axon to the axon terminal, and then it'll release a neurotransmitter, NT for neurotransmitter. That will go to the synaptic cleft, merge with the synaptic cleft, release its neurotransmitter. It diffuses across the cleft, binds to the postsynaptic neuron, and will then exert an effect. This yellow stuff is the myelin, the fat. It's like an insulation, like the plastic around an electric wire when you plug a plug into the wall. And it speeds up neuronal conduction. Okay, we have to go through a little bit of this stuff to make sense out of what causes a stroke and what causes brain damage. The main excitatory neurotransmitter is glutamate. Glutamate is about 90% of the neurotransmitters in your cerebral cortex. Okay, and then about 5%, and glutamate is the accelerator. Like your foot pushed on the accelerator, it's like flicking the light switch on. That's what glutamate does. All right, the opposite is GABA. GABA is only about 5% of your neurotransmitters in your cerebral cortex. It's a brake to slow things down. Okay, and then the other sort of more famous neurotransmitters are just sort of neuromodulators. They have a little bit of an effect on there. And that's things like dopamine, norepinephrine, epinephrine, acetylcholine, that sort of thing. So in a little more detail here, the main ion channels that open up along the axon are sodium channels to allow sodium to come into the neuron very quickly, and that makes its inner charge more positive. To make the charge more positive is called to depolarize. Okay, and then as the action potential travels down to the axon terminal, it then makes the axon terminal more depolarized, more positive in charge. That opens up the voltage-gated calcium channels, VGCC. Calcium comes into the axon terminal. So remember that calcium is the final accelerator step to say, yes, release neurotransmitter. And then that's what happens down here. So you need to know that calcium is the final signal that, yep, it's time to release that neurotransmitter through the VGCC. All right, here's a little bit about what your synapses look like with regard to depression. So depression, they totally exaggerated this. The psychiatrists, this serotonin theory, which is mostly BS, okay? They haven't ever been able to prove there's any single neurotransmitter mechanism for depression or any other disease. But what they do is they give these SSRIs, selective serotonin reuptake inhibitors. Normally, the serotonin is released across the synapse, binds to a postsynaptic receptor, exerts an effect. And then the serotonin from the synaptic cleft is taken back up into the presynaptic neuron through these reuptake channels. Okay? So selective serotonin reuptake inhibitor inhibits that reuptake. The problem is, what that's theoretically going to do is increase the amount of serotonin in the synapse. But in real life, that doesn't last for long. The postsynaptic neuron will compensate, and it'll express fewer receptors on its surface. In addition, the presynaptic neuron will express more serotonin reuptake transporters. So the brain fights the drug. That's an important point. The brain fights the drug. You take a synapse that was normal in these so-called mental illnesses, and then you change it with these medications, and those changes can be very difficult to reverse. So basically what I'm saying here is psychiatric drugs cause brain damage. Psychiatry is probably the worst field in all of medicine. They poison all these patients. They don't know what they're doing. They're grossly incompetent, okay? What I'm telling you is a fact. You've been lied to for the last 50 years, all this neurotransmitter mechanism of disease stuff. And what they're really doing is causing brain damage. The antipsychotics, they cause rapid brain damage and lobotomy effect, okay? Chemical lobotomy. The selective serotonin reuptake inhibitors like Prozac and the other ones, they cause a gradual onset lobotomy, brain damage. Psychiatry is a fake field, okay? Here is, and this has been known for a long time. Peter Breggin, the famous Harvard psychiatrist, have been telling you this. Thomas Schaas, the other famous psychiatrist, they've been telling you. There's lots of other ones. Joanna Moncrief, okay? Lots of other ones will tell you the same thing. Kelly Brogan, there's a whole bunch of them. Okay, and what I'm trying to tell you is, in the real world, you don't have this, one neurotransmitter per synapse and nothing else going on. Neurons are much more complicated than that. You've got GABA affecting, having a negative suppression effect on things. You got modulation by serotonin, dopamine, acetylcholine, norepinephrine. So it's more like an orchestra, a symphony, than it is a single one-man band type of thing going on. Okay, so that's why, some puny little drug is more likely to mess things up than to help. Here's another example of a synapse with multiple inputs. The complexity is much more than what we account for with our theoretical drug mechanisms. Okay, so here's a bit of a cartoon about what psychiatry is like. The patient walks up to the receptionist and she says, everything is based on science. We have lots of treatment options. So option number 1 is psychiatric medications for chemical lobotomy. Option number 2 is sit in the electric chair and you can get electroconvulsive therapy, which causes major brain damage, and that's an electrical lobotomy. If you want, and let's say you think the pills don't work, fine. They'll do a surgical lobotomy where they'll open up your skull. Okay, option number 4, run for your life. That's the best option. Psychiatry is a fake, stupid field. It's a bunch of crap. They're just lying to sell drugs. If there wasn't money in these drugs, no one would do these things that they do. And poor Ernest Hemingway committed suicide. Well, he'd already been poisoned with a bunch of drugs and had electroconvulsive therapy destroying his brain, so he wasn't in his full mind when he committed suicide, Ernest Hemingway. So here's another lady, smart doctor, Kelly Brogan. She wrote this book, A Mind of Your Own. She knows the truth. She's an Irish-Italian lady, very pretty. The psychiatrists who tell the truth, they'll tell you the truth. Psychiatry drugs are a joke. Okay, here's the best book ever written about psychiatry drug side effects by Peter Breggin, Harvard-trained psychiatrist. He goes, systematically through the complications of neuropsychiatric drugs. They're all bad. There's none of them that are good. You need to know that, because in my experience, the average patient's very stupid, very gullible. Whatever they're told, they comply with it, and they have terrible outcomes. They get poisoned, okay? They just get, poisoned, tortured, and they're stupid. They think, oh, well, this is the official way. Nobody gives a rat's ass about you, okay? You're a stupid pro. No one cares about you. Get that through your head. If you get that, then you've got a chance. If you recognize no one cares about you, they just want to sell drugs, get money from your insurance company, then you can figure out how to make progress in the system. But if you walk into it thinking, oh, all this modern technology is going to help me, well, then you're going to be a typical chump. Okay, let's see. We talked about that. Let's see if I got anything more along those lines. Okay, the next stuff I'm going to start getting into some more normal physiology, so I'll save that for next time. So I hope you found that helpful, and the key point of the lecture today was real neurophysiology at synapses is much more complex, like an orchestra rather than a one-man band, and they cannot improve it with drugs. They don't know how to, and all those drugs cause tremendous side effects, in effect a chemical lobotomy. So I don't think psychiatric drugs are a good idea at all. Maybe you've got some acutely, severely psychotic patient, you can give them a dose or two to tranquilize them like a wild beast, but stop right away because you keep going with that stuff. They all end up with brain damage. So anyways, hope you found that helpful.